How does latent TB turn into active TB? Have you ever wondered how a silent infection can suddenly become a serious illness? Let's explore how latent tuberculosis infection, or LTBI, can turn into active tuberculosis, often referred to as active TB. Latent TB occurs when Mycobacterium tuberculosis bacteria are present in the body but are kept in check by the immune system. This means there are no symptoms, and the infection is not contagious. However, this balance can be disrupted. The transition from latent TB to active TB happens when the immune system weakens, allowing the bacteria to multiply. Several factors can contribute to this weakening, including conditions like HIV infection, aging, malnutrition, diabetes, or treatments that suppress the immune system. When the immune defenses are compromised, the bacteria can escape their containment and begin to grow. Research shows that about 5 to 15% of individuals with latent TB will develop active TB at some point in their lives. Notably, around half of these cases occur within the first 2 years after the initial infection. The risk is significantly higher for those with weakened immune systems. At a cellular level, latent TB is marked by the presence of granulomas. These are clusters of immune cells that work to restrict the growth of the bacteria. If the immune response falters, the bacteria can break free from these granulomas. Infected immune cells, such as macrophages and neutrophils, may die in a process called necrosis, releasing bacteria that can infect new cells. This cycle of cell death and bacterial spread is what leads to the development of active TB disease. Interestingly, recent studies suggest that latent TB is not merely a dormant state. Instead, it exists on a spectrum, ranging from complete bacterial control to low-level bacterial activity that might precede active disease. This means that the risk of progression to active TB can vary widely among individuals. In summary, latent TB turns into active TB when the immune system fails to contain the bacteria, allowing them to multiply and cause disease. This failure can be triggered by various health conditions or weakened immunity, leading to the breakdown of granulomas and the onset of active tuberculosis. Understanding these mechanisms is crucial for developing preventive strategies that help keep the bacteria contained and prevent the progression to active TB. Always consult healthcare professionals for personalized advice regarding tuberculosis and any related health concerns.